dry needling, and I'm going to tap it. Hey guys, we have a really exciting episode this week on Accelerated Health. This is an episode where Dr. Patrick performs dry needling. Dry needling is a technique to reduce muscle spasms, tension, and also improves the mobility of the muscle that's constricted and in spasm. It'll also help speed your recovery. So check this out, guys. Good afternoon, everybody. It's Dr. Baker. So we're going to be doing some dry needling today on Carol's shoulder. Yikes. Wow. So we're going to prep the area with an alcohol wipe here. So Carol has had her hip done before, but not her shoulder. We're going to take a 25 millimeter by 30 millimeter dry needling, and I'm going to tap it like that. It's in. I'm going to advance the needle.
Does not hurt. Not one little bit.
Good. Okay, so it's stopped right there. So we're actually going to turn it to get right through that tissue. Good. You doing okay, Carol? Great.
Perfect.
Good. We're going to turn it. See how it's stuck? Look at the needle bend there. So we're going to take it out. We're going to advance it. We're going to take it out. A little bit more. A little bit more. A little bit more. Advance it. Right there. We're going to turn it to lock it in. Good. Okay. Now our second needle, we're gonna go here, tap. Oh, perfect. And advance it. We're gonna keep advancing the needle here, advancing the needle, keep going. We're gonna take it out, kind of stopped. Advancing it in and out. And you always want to ask the patient, are they doing okay?
Perfect.
Great.
It's perfect! My life is complete.
Perfect.
I don't feel a thing.
Great. Okay, we're going to do one more needle.
Bring it on.
Doing great. Here, tapping the needle. Advancing here. Doing great. Doing okay?
Perfect.
Great.
I couldn't be any freaking better.
Keep advancing the needle. And when it doesn't advance, you just take it out. Do a little different angle. Great. Okay, like that. So we're gonna let that set for 15 minutes.
Hi everybody, Dr. Danny here. We have one of our favorite patients, Sumati. She's been a patient of ours for quite a long time. She started in April of last year. And Sumati, I just want you to start off by telling the audience here what you started with, how bad your pain was on a scale from 0 to 10. So take it away.
But listen up now, this is serious.
Okay, April of this year I came. At that time I would say probably pain level was 10 about half a day, and then I was barely functioning.
Right.
I was hard walking,
Right.
I was dragging my feet and all, and hard to sit.
Oh boy, I gotta tell you, that sounds awful.
Yeah.
So once I came in, you guys took a evaluation, and then I got an immediate relief with the gabapentin and then a steroid on location.
Right.
But that was so that I can live with the pain,
Yeah.
handle the pain. But then I started coming here
Right.
twice a week,
Yes.
went through the adjustments, and then we talked about exercises and
Yeah.
what I can do and all.
And today, you started out at 10 out of 10 pain. You were taking gabapentin. You had a local steroid to just help you survive. really.
Yeah.
You
yeah.
weren't exercising. Your quality of life was really bad. It was hard for you to walk. I remember too, you had some weakness in your legs. It was hard for you to pick your feet up. And standing here today on a scale from 0 to 10, where are you now?
I would say most of the time it's none, no pain, but
No
it's
pain.
a one. Sometimes in the morning or when I get back to you. Certain times, or if I stay in my chair, you know, I still
Right,
work and I
right.
stay in the chair and or in the same position, it kind of, I can feel it.
Yeah, yeah.
So, and
So
then
you
I
went
would
from
say
a
one. Yeah.
10 down to a 0, and when you are in pain, that's a 1 out of 10.
1 out
so
of 10,
Nothing. And no gabapentin anymore, you said.
No gabapentin,
Amazing.
nothing. And I am back on my exercise routine. I started back on walking.
Yes.
You know, the walking and exercise, you know, like it was my routine.
Right.
I'm back on all that. You know, my life is almost to 90% back.
This is a win-win-win scenario for everyone.
Awesome.
I am so happy I found
Great,
you guys.
great.
That's all I can
We're,
say.
we're happy we can be here for you.
Yeah,
so
you helped us. Yeah,
awesome.
You helped me.
Awesome. So you heard it here, guys. Sumati down from 10 out of 10 pain, barely able to walk, down to 0 out of 10 pain.
Winning's winning.
She's doing amazing. Her quality of life's back. She's back to exercising. She's living the life she wants to live. That's great. Thanks, Sumati.
Thank you. I
guys.
appreciate it.
Hey guys, we really hope you enjoyed this week's episode of Accelerated Health. Now, remember, we only have a few weeks left with this contest, a testimonial contest. So you want to make sure to upload your video, make sure it's 1 minute or less, and send it to Dr. Patrick Baker at gmail.com or Dr. Paul Baker at gmail.com. Guys, let's get those videos in. This is an opportunity to win $500. So again, make sure you do that, and we hope you enjoyed the videos. And as always, make sure you like, subscribe, and comment